Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
What are the signs of myocardial infarction? In myocardial infarction, pulse will increase or decrease. Bradycardia is seen in the myocardial infarction, especially in the inferior wall MI. The bradycardia is seen. BP is found to be either increase in BP or decrease in BP is seen in the MI. And sometimes there can be presence of signs of heart failure may be seen in some of the patients, like signs of heart failure like raised jugular venous pressure. Third and fourth heart sound is also seen in these patients with basal crepitations. Okay, then the other signs are there can be presence of pansystolic murmur is present, and this pansystolic murmur will result in papillary muscle. It will result in papillary muscle dysfunction, or this can result in rupture, or it can result in ventricular septal defects, or it can result in a pericardial friction rub. Can also be seen in the patients with um, myocardial infarction.
thank you and thank you for watching.